Hello, and welcome to Cottage Health's Meet the Doctor webinar. Today, we're going to discuss how to partner with your primary care physician to stay healthy and manage chronic conditions. I'm Christina Cortez, the Public Relations Manager for Cottage Health and your host for today's session. Before we get started, I'd like to review a few housekeeping items to optimize your experience during this webinar. At the conclusion of this webinar, we will host a brief question and answer session. Please use the Q&A button to ask Doctors Yana, Gristan, and Arielle Canner a question. This webinar is also being recorded. We will email you a link to the recording afterwards so you can rewatch at your leisure. It's now my pleasure to introduce Doctors Yana Gristan and Arielle Canner, primary care physicians at Cottage Primary Care, Santa Barbara, Oak Park. Dr. Gristan earned a Bachelor's of Science in Biology at Marymount Manhattan College. She received her Doctor of Medicine degree at Ross University School of Medicine and graduated with high honors, and completed her internal medicine residency at Santa Barbara Cottage Hospital, where she developed a passion for primary care and the Santa Barbara community. Dr. Canner earned a master's degree in organic chemistry at San Diego State University. She received her Doctor of Osteopathic Medicine at Touro College of Osteopathic Medicine and served as the chief resident at Santa Barbara Cottage Hospital. She is dedicated to serving the community with a focus on health and well-being and is passionate about empowering others to achieve their best health outcomes. So now, without further ado, please join me in welcoming them both.
Hi, welcome. Thank you everyone for coming and joining us. Yana and I are very excited to share this time with you and to introduce you to Cottage Primary Care. We'll get started with just a brief overview of what we're going to be talking about today. We'll have a quick introduction. We'll talk about preventative care itself, comprehensive medical assessments, building or managing chronic conditions, building a long-term relationship with your physician, and we'll finish up by looking towards the future for Cottage Primary Care.
Alrighty, so what do primary care physicians do? So we provide personalized, comprehensive, accessible, and continuous healthcare services. We aim at addressing a wide range of health needs. At its core, primary care focuses on building a strong doctor-patient relationship, focusing not only on your physical health, but also emotional, social, and cultural aspects of each individual. We act as advocates for our patients, helping them navigate the healthcare system and make informed decisions about their health. And we often serve as a first contact point for patients that are seeking healthcare services. And alongside preventative healthcare, we also provide acute care to common illnesses and injuries, as well as chronic disease management and health promotion. We're committed to empowering our patients to navigate their health journey with confidence by providing them with education, clear communication, and overall support as a multidisciplinary team.
Preventative care is the foundation of primary care, and accessible medical care allows for early disease detection, reducing the burden of illness and promoting a healthier population in whole. We aim to foster health equity by providing the opportunity to receive essential and personalized medical services in an easily accessible and timely manner, in the hopes of contributing to an improved quality of life and overall wellness. Health promotion is about creating an environment that supports overall wellness. Our clinic encompasses a wide range of strategies and interventions that are designed to improve health outcomes. This includes raising awareness about healthy behaviors, preventative measures such as vaccines and screenings, and lifestyle modifications, including promoting regular exercise, balanced nutrition, and stress management. Early disease detection is crucial in preventing chronic conditions. It allows for timely interventions and treatment, which often results in better outcomes. Identifying health issues in their initial stages provides the opportunity to manage and potentially even cure conditions before they progress to become more challenging to treat. Our goal is to empower all of our patients to take control of their own health, make informed decisions, and create an environment that supports a healthier lifestyle, ultimately preventing illnesses and enhancing overall quality of life.
So what are some of the things that we do? Well, we provide a comprehensive health assessment to all of our patients. This includes a detailed review of all of your past medical history, including past illnesses, surgeries, the medications that you've been on, family history. We perform physical exams. We focus on vital signs, pertinent organ systems, and any specific concerns raised by the patient, of course. We order and interpret appropriate lab tests and screenings based on national guidelines, age, risk factors, and presenting symptoms to detect any underlying health issues. Evaluate lifestyle factors such as diet, exercise, and sleep. And furthermore, we aim to recognize and discuss any mental health issues, including stressors, emotional well-being, and the potential mental health disorders. We provide guidance on immunizations and screenings, as Dr. Canner mentioned earlier, and preventative measures. And we do this all through a collaborative approach and through a shared decision-making process with our patients. If necessary, we coordinate care with other specialists and other healthcare providers, and we develop a personalized follow-up plan. Finally, we encourage an open and collaborative communication with our patients. Living with chronic health conditions can be emotionally challenging. At Cottage, we provide a consistent platform for patients to express their concerns, discuss emotional well-being, and provide an environment that ensures that our patients are receiving the necessary and continuous support that they require to help them cope with the persistent nature of their illness. Ongoing monitoring allows for efficient control of such chronic health conditions by way of medication management, so assessing effectiveness of those medications, side effects of those medications, and making adjustments as necessary. Early detection of potential complications or changes to the condition, allowing for timely intervention. And routine follow-ups provide more opportunities for continuous health education so our patients can better understand the nuances of their chronic health conditions so they can make more informed lifestyle choices or better informed lifestyle choices.
Primary care serves as the center of the healthcare system, and primary care physicians help guide patients through that system by providing continuity of care. What that means is creating a consistent healthcare experience for the patient by allowing us to keep all of your medical information organized in one place. This helps our patients receive seamless, coordinated care from various providers throughout the healthcare system and specialists, ensuring efficient information flow that reduces medical errors and promotes a holistic understanding of the patient's health over time.
One of the most important aspects of primary care is building a good long-term relationship with our patients. And we're committed to providing an approachable environment that works collaboratively with our patients. We like to think that a strong, supportive physician-patient relationship should be thought more of as a partnership, that we're working together. We aim to provide a positive environment that fosters open communication, mutual respect, empathy, and attentiveness. Finally, we're committed to staying informed through continuous medical education, not only to maintain competence in our field, but also to ensure that we're providing the most top-notch, high-quality care that our patients deserve.
As you can tell, we are both very passionate about building a long-term relationship with our patient and see how important that is to knowing and understanding everyone that comes into our clinic. Having this long-term trusting relationship provides a platform that allows an open and honest environment for patients and physicians to manage chronic conditions together as a team. It provides a safe place for patients to ask questions and for physicians to set goals that align with the patient's values.
Finally, what are we doing? We're looking into the future. So at our clinic, we foster an environment of innovation. We conduct comprehensive analysis of existing workflows, technologies, and patient engagement strategies. We identify areas of inefficiencies that may enhance the patient experience or improve the clinical outcomes at regular intervals. Our connection to Cottage allows us to leverage high-end resources and data-driven insights to enhance primary care to our community. And we encourage idea generation and work together as a team to tailor interventions and best practices in the hopes of enhancing the overall patient experience here at Cottage. And looking into the future, our advanced and robust technological software enhances accuracy, accessibility, and sharing information across specialties for more coordinated and informed clinical care that is delivered in a seamless and timely fashion. This reduces redundant tests, enhances coordination of patient care across multiple different platforms. Finally, our patient portal allows our patients to access their health records, schedule appointments, and communicate with us and other healthcare providers in the hopes of improving physician-patient communication and empowering patients to actively participate in their healthcare.
Some things that are coming soon to Cottage Primary Care that we're really excited about include some of the things on the screen and even more. We are implementing remote heart monitoring devices that allow us to track in real time with data and assist in proactive management, early detection, and personalized care plans. They'll also assist to help us coordinate more timely and efficient transfer of care to cardiologists if needed. Our telehealth and virtual visit services offer virtual consultations that enable patients to access care remotely, which improves accessibility and flexibility, which is often a problem in the Santa Barbara community. Our appointment scheduling software that is coming soon will help patients to make appointments online for more fast and efficient scheduling. And we'll be hoping to incorporate collaborative care models into our clinic to bring more providers under the same roof and increase the continuity of care across specialties. We hope to partner with the Cottage Research Department and participate in research studies in the primary care office and become a teaching site for the medical residents as part of medical residency with Cottage Hospital. And we will soon be implementing some AI into our clinics to help streamline our note-taking, and look forward to all of that coming in the future and more. So that was quick, but we thank you all for joining, and we are so happy to be part of the team. This is a picture of our lovely MAs and RN and our office manager, Polly, that we could not get through a single day without them. So thanks again. And
thank you, Dr. Gristan and Kenner, for the wonderful presentation. We'd now like to open the room to questions. For our attendees, please remember to put your questions in the Q&A box, and I'll read them to Dr. Gristan and Kenner to answer. So our first question that has come in, what sets Cottage Primary Care apart from other primary care practices in Santa Barbara?
I can take this one. I think that at Cottage Primary Care, we have a unique opportunity to utilize all of the resources and experience from the whole Cottage health system and expand that into primary care, which really allows for seamless integration and connections between our doctors in the Cottage network and our patients, between the hospital, between our new and growing specialty clinics, the urgent care centers, and their hopefully home base, the primary care office. Yana and I both completed residency here at Cottage Hospital, so we know the ins and outs of the hospital and have been able to foster really great relationships with so many different physicians, primary care doctors in the community, specialists in the community, hospitalists, and we're lucky to be able to tap into those resources when we need them. We are dedicated to continuing Cottage's mission of providing compassionate, patient-centered care to the Santa Barbara community, and happy to be able to do that here.
Wonderful. Another question is, and you might not know this at the top of mind, but what is the current wait time for a new patient to get in for an appointment at the Oak Park Clinic?
I think that right now we're scheduling out into April, so about a month for now. If that's probably not 100% accurate, but something like that. So a couple of weeks to a month right now.
Okay, and I guess this transitions to our next question. What should somebody do if they're having a hard time getting in with their primary care physician and to be seen in a timely manner?
Well, we do have a wait list of cancellations, so you can always put yourself on a wait list. We are working on, just like any startup, we are working through some kinks and trying to streamline our workflows as well. Our goal is to keep slots open in the middle of the day for urgent matters. And right now it seems to be working out pretty well. I was able to see someone the same day today. That can't always be a guarantee, but that is our future goal, is to carve out dedicated time for those individuals that may need same day care.
We've also tried to incorporate having Lulu, our RN here, our nurse, to be able to kind of triage some of those calls and issues. So if somebody if they were already a patient of ours and was trying to get in for whatever reason, they would contact our office either via MyChart or they could give us a call. And those calls can be triaged through the MAs to our RN, Lulu, who could kind of assess, is this an urgent need that they need to get in here, and then, talk to us and try and move around our schedule? Or is this something that can wait and maybe we can see them in the next few days? Is it something they need to go to the emergency department for, or maybe go to urgent care?
Okay, great answer. Once a patient is an established patient within your practice, if they have a medical concern that may not be emergent, would virtual visits be an option?
Absolutely.
Definitely. We have set up in our office the ability to have virtual visits, and we hope to really start to incorporate those more and more. Sometimes it's much easier to jump on the computer or jump on your phone and have a visit instead of, get off work, try to do it at your lunch hour when we're not even seeing patients at noon, and just kind of hop on, do a quick visit for, whatever checkup they need, and then get off. So very, very much a part of our practice here.
Great. Our next question is for, I think both of you could answer this one. What is the different level of care that each of you offer? Like one being a DO and one being an MD, or are there differences?
Arielle, speak to that one. There's no difference except for Arielle does a little extra musculoskeletal stuff, and I'll let her speak on.
And I love that answer because I often get that, or our MAs or our RN will get the same question, what exactly is a DO? And why would I want to see a DO over an MD? Or why would I want to see an MD over a DO? And the answer can be very specific to each person. So a DO is a fully licensed medical doctor that can sometimes bring a unique patient-centered focus to a practice. DOs complete medical school, they take medical licensing exams and complete residency programs along medical MDs. DOs do believe that the mind, body, and function are interconnected, and in order to promote health and well-being, all of those aspects need to be aligned. We do receive special training in medical school on the musculoskeletal system and lymphatic systems, and we learn different techniques and modalities to treat physical ailments. You can think of, we take an 8-credit course every year of medical school that encompasses like some chiropractic techniques, some massage muscular techniques, some energy, a little bit of energy work. And it's really up to each individual DO what they want to do with that. So DOs go on to practice in all different specialties: cardiology, surgery, internal medicine, emergency medicine, dermatology, you name it. So I don't really see a lot of dermatologists trying to do musculoskeletal medicine, but they may. Intensive cardiologists may or may not. It really is dependent on that person's desire to really keep practicing that hands-on medicine. So here, personally, I am interested in osteopathic manipulations and some of those modalities. I think that they work great to kind of center your mind and body together. And hopefully I'll be able to incorporate those more into our practice as I get a little bit more established here. But majority of the time, I'd say Yana would probably agree. I think 95% of the time we're doing the same thing. Sometimes I'll put my hands on somebody's back and do a little bit of manipulation, but I hope that helps.
Nice. Thank you for that explanation. For our next question, for somebody who is already seeing a provider for hormone replacement therapy, and let's say they became one of your patients for primary care, would they continue seeing their provider or their hormone replacement therapy specialist, or would you as a provider manage that for them?
It would really be up to the patient and what they're comfortable with. We like to think ourselves as one of our mentors taught us, internists with a capital I, meaning we try to do everything that we can here in the office. And I hate to use this phrase, but we're a bit of jack of all trades, master of none type of deal. So we can handle pretty much everything until it gets a little too complicated. Hormone replacement therapy we can do if it's ongoing for, so there's certain guidelines for how long people should be on hormone replacement therapy. And if those guidelines start to get stretched, that would be when a specialist would be helpful. But if the patient is comfortable transferring their services over to us, we're more than capable of managing hormone replacement therapy at our clinic as well.
Okay. And transitioning to similar realm, what about well women exams? Would patients come to you, or would they go to an OB-GYN for that?
That is kind of the bread and butter of, I think, our practice too. One of the things that internists should be able to do, we are more than happy to do well woman exams for patients. Or if they have a GYN that they love seeing and they want to keep seeing, we're definitely happy to partner with them as well and for anything that they need.
Okay. Dr. Kanner, we got one question specific for you. If somebody who's in their mid-70s, healthy, already has a strong exercise program, how can your protocol assist with additional information to improve health that isn't problem-oriented but progressive? Like what unique advice as a DO would you offer?
I think I would probably offer the same, I would hope I would offer the same advice as any other physician. If you're already in great health and you're staying active and having a good diet and proactive with your health, to keep doing that. I don't know if I would offer anything exceptional there besides, a high five and saying, good job making it to 70 and keeping on your feet, keep going, keep doing what you're doing, and make sure that you spend some time and allow yourself to have some time to keep that mind-body connection going. And take some time to do some deep breathing and make sure that you are thanking your body for everything that it's done for you for these past 70 some years, and for everything that it's going to be doing for you for the next however long.
Nice. Another question would be, if somebody one of your patients is diagnosed with Parkinson's disease and they need to see a specialist, how do you work with those specialists to ensure that your patient is receiving comprehensive care?
Well, we are in constant communication with all of our specialists. So if any of my patients are seeing a cardiologist, a neurologist, an endocrinologist, a podiatrist, whatever, I'm always in contact with those individuals. I want to know what the plan is. The idea of a primary care physician is that we are sort of the captain of the ship, right? And we can't operate on our own. We need engineers. We need people that are smarter than us. We need people that are specialized than us. And we also need people with different skill sets and support staff, right? But in order for that ship to run and be safe and efficient, we have to be checking in on all of the staff members, right? And so that includes staying in constant contact with neurologists, making sure that we have the updated notes, the updated plan. And if we aren't getting that updated note or updated plan, we do a really good job, and our front desk staff does a really good job of gently harassing those individuals to get that information. And then furthermore, we're really lucky in that we've built some personal relationships with the specialists in the area here doing our residency here, and they have been all super kind and helpful in helping us out getting started. Since Arielle and I are brand new, we don't have 50 years of experience under our belt, but what we do have is an extremely close timeline to the literature, and really good connections, and luckily good rapport in the community, and a good set of doctors and specialists in the area that are willing to help us out and provide us with information when we need it. So we can kind of sort of provide a modified VIP treatment if needed for now, while our patients are all manageable.
That's great. Let's see, another question that came in. How often should someone in their late 40s schedule a routine checkup?
Depends on your health, right? So in your 40s and your late 40s, at that point, probably annually. If you have chronic health conditions, other things that are being managed, it would depend on where those conditions are, how well controlled they are. And so that's really an individually based answer. I would say individuals less than 35 years of age that don't have any medical problems, that generally feel well, that are not obese, that are not overweight, that are taking care of themselves, don't necessarily need to see a doctor every year per the literature. But I think in your late 40s, it's time to check in, because this is when we start thinking mammograms. At the middle of 45, we start talking about colon cancer screening. We're creeping up to certain vaccines that are needed in the older population. Not that 40 is old, but it's a good time to start checking in, and then we can go from there and decide how often, and we can personalize things. So our patients are not textbooks. So if our textbook says come every year, but our patients want to come every 2 years, we talk about that and make a plan together, and we always try to compromise and meet patients at the individual level.
Great, thanks. So what is the best way to find a new provider for yourself besides picking a name from a list?
Well, that's a great question. I think if you know anyone in the community, kind of asking around your friends, who do they see? Do they like who they see? Or what has been their experience where they've been? Looking at people's backgrounds and little bios, I think, is helpful on websites if they have them, and trying to see that your wishes and goals align with the things that they're looking to do in their practice as well. Yana, any additional pearls?
Yeah, I mean, I think at the end of the day, the long story short is that Arielle and I provide essentially the same services, and we follow national guidelines, and we ask the same questions, we promote the same preventative measures, and we try to do right by our patients in every way, right? So I think that is a difficult question to answer. There is no difference between an MD and a DO. So just as much as she would focus on homeopathic measures, I focus on homeopathic measures as well, and I do find them to be important. Do I know how to do all of the chiropractic manipulation and things? No, I'm definitely limited when it comes to that. But I think it would ultimately come to, who do you think you're simpatico with, and who do you think that you can talk to? Who do you think understands you and the conversation flow? And I think meetings like this, hearing the way that I talk, my perspective on things, my personality, versus Arielle's, just go based off that. There's a few videos of us kind of introducing ourselves that are absolutely horrible, and we're very nervous, and they're in the very beginning, but there's plenty of sort of creeper material, if you will, out there on the internet that you can find. But we like to think of ourselves as equals and providing equal education. We got equal education. We went to the same residency program. We had the same attendings. We went through all the same ringers. So that's a difficult question to answer, but I think if you're focusing a lot more on more homeopathic measures, things that focus more on energy healing, and sort of actual musculoskeletal manipulation maneuvers, then I would favor Dr. Canner. If you are, and she can handle very complicated medical patients as well. I honestly don't know how to finish that sentence because I go in a wrong direction. So
Well,
stop there and say, just pick who you think is the prettiest.
I will add on to that. And I think that's a great question, because I remember kind of trying to find a primary care doctor when I was in college, and I just went on my health insurance website and scrolled down a name until there was one that I was like, well, I guess that sounds like a normal person, and walked in. Did I like that doctor? No, I definitely did not like that doctor, for no real reason except for we didn't really click, and I didn't think that he was interested in my health and well-being. So I think that that is a really important point. If you ever do see a physician that you don't mesh with, you don't have to stay there, hopefully, depending on your insurance. But I think that's really important, to have a relationship that you're trusting with, that you believe they're bought into your health and they understand what is important to you in your health. Because just because the guidelines say that you're supposed to take this medication because your numbers on this lab is this thing, that's not, you're not going to go to jail if you don't take it. And it's important to be with a doctor that understands how you think about medicine and health and what you want out of the rest of your life, because hopefully they'll be there with you for the rest of your life. And if it doesn't mesh, don't stay. You wouldn't go back to somewhere that cut your hair and every time you went, they give you a bad haircut, and you shouldn't do that with your doctor either.
And just so everyone knows, if you come in and you establish care with me and you think I'm horrible, we don't get along, and I'm just not understanding you, then you want to switch over to Dr. Canner. It is no hard feelings. We can switch over. You can establish care with Dr. Canner, and we can do it that way. We'll find a way, and I promise you our feelings won't be hurt, and we'll do everything that we can to get you the right primary care doctor that you need.
Thank you both. That was really, really good explanation. We are nearing the end of our session. We have time for one more question. So it is, you mentioned an emphasis on cutting edge prevention, detection, and early treatment. Can you give examples of tests or screenings that you promote, or upcoming technologies that you hope to promote soon?
Yeah, absolutely. I can touch on a few, and then I'm sure Dr. Canner would love to talk about upcoming things. She's a little bit more technologically advanced than I am. But we offer screening. First of all, pap smears are screenings, right? So these are your well woman exams. These are protecting you from cervical cancer. Mammograms, colon cancer screening, that's all a part of our job. Routine blood work that includes checking for diabetes, checking your cholesterol numbers, checking thyroid function. These are all things that we do. And based on your age, based on your risk factors, based on things that you do, your social choices, there are other screening options that we offer individuals that can be a little bit more personalized, a little bit more personal and private. And then moving forward, as far as innovation goes, I think Dr. Canner has some points that she would like to speak on in regards to that.
Sure. So we are very actively investigating different platforms using AI, both to help take notes, like ambient AI that will be in the room to help take notes with providers. And that also helps to kind of streamline the whole flow of the visit. And that also encompasses, it's listening to the things that we're talking about. And sometimes we might not catch every single thing, or the connections in our brains might not work right then in that moment. And the ambient AI can have the opportunity to kind of connect those strings that we might be missing and propose, when it's helping with the note, did you want to maybe consider ordering this based on the things that we were talking about, or the lab values, which I think is a great use of technology and information. And then it's the provider's choice to look at that information and say, oh yeah, this lines up. That's actually a good point. Or maybe I should look into this a little bit more, or say, oh no, this, is kind of not what we're doing. People might get scared about incorporating ambient AI into healthcare because it is such private, personal information that we're sharing. And that's why we haven't just implemented it already. Our teams are looking to see, what are the repercussions of having something listening, and how do we keep that data safe and protected? And hopefully that'll be coming, more information soon. Other things for screening, we're since Yana and I are just out of residency, we're pretty up to date on literature and screening and guidelines. We often will catch people that are on medications that we're like, the guidelines for this changed 3 years ago. Maybe we should update you. And this is, what people are doing now. And this is the data behind it. This is the reasons why we're doing it. Just the other day, we added a new Pueblo Radiology added a new scan for bone density that I was very interested to get for some of my patients, to help kind of add another level of information for bone density screening for osteoporosis. It wasn't even available in our computer system yet. So I added a ticket to the IT team, and hopefully that'll be in there soon so that we can provide, really the most up-to-date screening recommendations or modalities that we have in the Santa Barbara community.
And I think we're also going to be doing some genetic testing coming up if necessary. And I think all of these innovations for screening, they require a lot of conversation, not a lot of conversation, but some conversation with the patient. So I don't want everyone to take our answers as blanket answers in regards to screening and innovation and AI and genetic testing. These are all conversations that we have with patients. We discuss risks and benefits of these things. We make a shared decision, and we make sure to stay informed and give you the truth behind everything and exactly what's going on, so you know what we know and we make that decision together.
Great. Thank you both so much for that. This has been a really great Q&A session. We have reached the end of our time, so I wanted to thank everyone for your questions and for joining us this afternoon. Please note that Cottage Primary Care Santa Barbara Oak Park is located at 2329 Oak Park Lane in Santa Barbara. Immediately following this presentation, you will receive a link to request more information or to make an appointment with our Primary Care Oak Park Clinic. We will also email a recording of this presentation in the coming days. If you have further questions or would like more information, you can always call 805-563-7010 or visit cottagehealth.org/primary care. And finally, a brief survey will appear after this webinar closes, and we'd love to hear your thoughts. So please fill them out. And thanks again for joining, and have a happy and healthy rest of your day.